India is often called the diabetes capital of the world. And here's a startup that is trying to solve a big problem around diabetes. Can't eradicate diabetes, but can certainly help those suffering from it. The startup is called Beat-O and has just raised $33 million from Lightrock. Let me go across to the co-founder Yash Sehgal for more on this. It's not about fundraising, but we thought with the way the diabetes cases have been exploding, India getting set to overtake China too with 200 million cases, it's good to put the spotlight on this silent endemic. Yash Sehgal, thank you so much for giving us time. You can't kill diabetes, you can't cure diabetes, but you can just help patients, like I said, who suffer from diabetes, which is also hereditary. Sometimes it's lifestyle induced, sometimes we don't have a choice, we just inherit it. What exactly does Beat-O do?
So we try to address this at the heart of what you're trying to say, suffering. You know, the whole concept of having a condition or a disease is that you're going to start suffering. And when I was diagnosed with diabetes at 34, I had no concept of wanting to suffer at all in my life. And it was all about empowerment. So for me, Beat-O was the first step of trying to give back to the users or consumers who had a similar condition and wanted to empower themselves. So Beat-O is really a digital platform which allows the consumer, which is the user, to be at the center of the solution. And we provide chronic condition management for them to empower them to lead a healthier life. At the heart of the solution is a device which connects directly to your smartphone. It's a glucometer. It's a smart glucometer which allows blood sugar readings directly to come onto the device, onto the app. And because the readings come on the app, it goes to the cloud, and we can do instant monitoring and analysis of that data and provide actionable insights to individuals in a personalized manner. So in your particular case, if your blood sugars are low, our advice would be distinctly different to maybe someone like me whose blood sugars might be high. So actionable real-time insights lead to incredible results and consumers being able to take control of their lives. So whether it is just monitoring their sugars better or changing their lifestyles a little bit and tweaking those, or even changing their food habits a little bit to ensure that their blood sugars remain in control. That's our goal.
So can I ask you this question? And I don't mean to be rude, but just to understand how you would be better off than people suffering with bad diabetes wearing an Apple Watch, which is far more expensive, or many other smart wearable devices now.
So the distinct difference is that in order to, once you're a diabetic, and I'm just going to refer to the word, you keep using the word suffering. For us, it's about empowering users to be able to manage their condition much better. And an Apple Watch just does not do that because it doesn't measure your blood sugars. You need to have an active monitoring of your blood sugars to be able to take charge and understand how your body is responding to certain medications, certain types of food, certain types of exercises. So for us, taking all these inputs, taking input from an Apple Watch also, and adding the layer of blood sugar and then providing feedback to the consumer is very important from a metabolic disorder perspective. And that's how Beat-O comes into play. We're able to take data from all third-party devices, whether it's an Apple Watch or other Fitbits and so on and so forth, get that into the Beat-O ecosystem and allow actionable blood sugar monitoring readings to come on top of that as a layer, provide insights to the users to take corrective action.
We should talk about empowering diabetics as opposed to talk about them suffering. So I talked about Lightrock, which has entered, and we don't really do funding news on this show, Startup Central, but because you're solving such a big problem, we in our family, we have so many people suffering from diabetes that we want to empower. We do say that, it is a silent endemic. Now, having said that, can you tell me how having Flipkart on board has helped? Is it about distribution?
Absolutely. So for us, as we started to build the foundation of Beat-O, we realized that access and affordability were key aspects which we wanted to address. 80% of the people who are diagnosed with diabetes have uncontrolled blood sugar levels. So these are people who know they're diabetics, yet their blood sugar levels are very high. So for us, it was very important to be able to address this pain point with people who were actually couldn't find ways to manage their condition. So we start with a simple monitoring device, and then we add a full layer of care solutions that we are able to offer to consumers. And 70% of Beat-O users come from tier 2 cities and beyond. So for us, we wanted to build a solution which was addressing this problem at the heart of our country in Bharat. So Flipkart is a natural integration for us. An e-commerce platform, or possibly India's first most successful platform, which goes to the each and every nook and corner of this country. We want to be able to use them to get access to distribution to the last mile. And for us, the Flipkart partnership was a natural progression.
Okay. So can you tell us what you're going to be doing with this $33 million check? What exactly is it going to be used for?
While we are humbled and grateful to the love that we've got from some investors to build the next phase, our largest intent with this is to continue to invest in technology and build our leadership team. We clearly see that we have to solve this problem, and a very large problem for India. Then we need to ensure we continue to build on our clinical skills, provide constant and up-to-date treatment for people, and build engaging programs for them which are personalized in nature. So a lot of money would be going into that. Would also be going into ensuring that if we are to build a solution which is affordable, technology has to be at its backbone, and we will continue to invest in that area.
Okay, here's wishing you and the entire team at Beat.O all the very best. It's a very, very big problem that you guys are solving.
Thank you so much, and we look forward to empowering millions of Indians. Thank you.
We've been talking a lot